Hey guys, my name is Paige Rochley, and this week we are talking about inpatient services and facilities. So let's get started. And just a little FYI, I have made a PowerPoint that I'm going to include and link it in with my presentation for you guys to follow along with. So we're going to start off with a little basic definitions. What is an inpatient service? So, an inpatient service is used to explain when a patient stays overnight at a hospital or a healthcare facility, and the patient no longer needs care from the hospital. They are discharged to go home or to a long-term care facility or an at-home nurse, something like that. So as we talked about last week, with outpatient services, which is kind of the opposite of inpatient services, there's slowly been a decrease in the rate of inpatient services as outpatient services are becoming more popular. We talked about that last chapter. So types of inpatient facilities. Hospitals are one of the biggest ones. There's multiple types of hospitals: public, private for profit, private for nonprofit, and children's hospitals. We also have psychiatric centers, rehabilitation care centers, and long-term care facilities. I chose to talk about the ethical and legal issues that come along with inpatient services because they're really misunderstood and a lot of people don't talk about them. I also find law really interesting, and law and health kind of really interests me. So we tend to see the most issues in inpatient facilities as they're dealing with really big life and death issues usually, with surgeries and medical decisions and stuff like that. So hospitals and health professionals tend to make decisions based off of four main ethical principles. The first being respect for others. And this is kind of your basic treating the patient with respect and dignity, and how they make their decisions. So the second one is beneficence, and that the hospital has an obligation to make the decision that brings the most benefit to others. And the third being non-maleficence, and that is the obligation that the decision they make brings the least amount of harm to the most amount of people. The last being justice, which is the right versus wrong, kind of the legal issue. And that is, is the decision both fair and equal to everyone involved? Especially, this comes into play especially with future patients, as we'll talk about a little later. So in an inpatient facility, issues arise that tend to deal with consent and confidentiality, patient rights. The biggest one that I'm going to talk about is the discharging of patients, but another big one that we see is advanced directives such as a living will or a do not resuscitate or a DNR, and that has to deal with when patients are unable to consent for themselves, what happens, who makes their medical decisions, stuff like that. So I'm going to focus again mainly on the ethical issues that arise with the discharge process, as it doesn't always go as planned and it's not really talked about very often, and it was really interesting to me. So let's get started. So the article that I chose was Difficult Hospital Inpatient Discharge Decisions, the Ethical, Legal, and Clinical Practice Issues, and it was written by Robert N. Swindler, Therese Seastrom, and Wayne Shelton, and it was published in the American Journal of Bioethics in 2007. So this article was really interesting to me because it discussed a few situations and decisions, kind of examples that tend to arise in an inpatient facility when dealing with discharging a patient. And it really showed me that a lot of attention needs to be brought to these areas, and there's so much more research that can be done. Like, I just scratched the surface. There were so many articles to filter through going through this, and a lot needs to be done by medical ethicists to go deeper into this topic. So discharging a patient is regulated by both the state and, especially for the elderly, the Medicare's conditions of participations. The biggest thing that we need to realize is that both the hospital and usually the patient, when they are able to be discharged, they want to get out of there as soon as possible. The hospitals want the patients to leave because of the cost, usually financial reasons. Each unneeded day that the patient stays in a hospital is absorbed, the cost is absorbed by the hospital. It's also cheaper for the patient because their insurance is not usually likely to cover the cost of unneeded care. So when they're discharged, they usually want to leave. And so the Medicare's conditions of participation states that the discharge obligations of a hospital are as follows. So they are required to identify the patients in need of discharge planning and provide them with the discharge plan. This is obviously the job of discharge planners to get medications ready, get aftercare facilities ready, stuff like that. And they are also required to provide counseling for the patient and family members as needed. They also provide the patient and family with a list of facilities that offer at-home care if needed to make sure that they're comfortable when they leave the hospital. They're also arranging for the implementation of the patient's discharge plan to get them moving quickly and forward and out as soon as possible. And also to make sure that the patient is aware of their procedural rights and their right to refuse care and refuse medical attention, stuff like that. So one of the main issues that this article talked about was an elderly patient is admitted to the hospital with chest pain. After a workup, proper diagnosis, and treatment, her physician tells her that she is discharged to go home. But she states that she does not want to go home. The hospital ends up giving her another day, and the next day she says the same thing. The hospital gives her a hospital inpatient notice of non-coverage, stating that if she stays, she will be financially responsible for her care. This is a really big moment. So the hospital has been required to notify the patient that if she stays, her insurance and the hospital is not going to cover any of the further costs. So they will be out of pocket for her. The patient then decides to ignore the notice, and she's now been at the hospital for a week. So this arises the question, what should the hospital do? So the ethical discussion that comes in is this is really not a rare issue and has actually been featured in a lot of court decisions, newspaper articles. It was even Grey's Anatomy, which we all love. And it actually factors in all 4 of the main principles of ethics, which is why I found it really interesting. So for respect for the patient, the hospital is required to respect the patient's wishes, as the patient has the right to refuse care and leave the hospital. But does the patient have the right to remain in the hospital even when care is not deemed necessary? I mean, we usually see the respect for the patient issues come in when a patient wants to leave the hospital, doesn't want care, and we have to respect that issue. But when it's opposite, what happens then? So you can see kind of like where the gray areas are. Then we have the beneficence, and the hospital is obligated to do good for the patient and has done so by giving her the treatment and the medication that she needs. But they need to recognize that her not wanting to leave might be coming from outside sources such as economic or social factors that might require therapy, something like that need to be addressed. So they're not really looking into other factors and other aspects that might need addressing. And non-maleficence, the hospital is obligated to bring no harm to the patient, and this usually applies to medical decision-making. But in the case of this patient discharged, does that mean that the hospital is required to provide her with goods and services indefinitely? So it kind of arises the question, are they forced to take care of her even when she doesn't need it? So you can see where this is kind of an ethical dilemma, and we've got a lot of questions going on. And the last one, justice, which is, again, your basic right and wrong. The hospital is obligated to treat everyone fairly and allow everyone a chance to be treated. In this case, the patient is requiring that many people and services and money be put into her, and she doesn't necessarily need them, and that is taking away those services from other people who do need them. So that is the big question. Are they really following that justice? Because she's taking up a bed and nurses and all that stuff when another patient could come in who the care is necessary for them. So what do you guys think? Do you think the hospital has a right to force the patient out of the hospital? And I actually read further into the article, and it was really interesting when we got further into like legal issues. They are obligated to force her out of the hospital. And that is where you see a lot of the court decisions come in, because she has the right to appeal the decisions and everything. So they do have the right to force her out of the hospital, which was really interesting to me. So the second issue that I'm going to talk about is an elderly man lives alone and is found unconscious in the hallway of his apartment by his neighbor. He is hospitalized, diagnosed, and treated. After 4 days, his physician concludes that he is safe to be discharged, but will require at-home nursing services for an extended amount of time or the rest of his life. He actually passed out due to insulin shock, so he has diabetes. And the patient refuses the service, and despite both the doctor and his son's wishes, he is adamant about going back home and living alone. So what should the hospital do? So the ethical discussion that comes in is, this again is another case that is seen really often, especially with the elderly, and men. They don't want to give away their pride, and they don't want to give up their sense of independence. So they tend to lean more towards the side of, I'm okay, I can do it on my own, stuff like that, rather than take the help. And this ethical issue really comes down to the difference between respect for the patient and beneficence. Respect for the patient has a right to make his own decision and refuse the care that's being offered to him, even though it is not what it is advised. So it kind of comes in, the hospital has to grant the patient's wishes, and that kind of folds into beneficence, and the hospital has an obligation to do what is most beneficial to the patient. But when the patient is an adult and he can form his own decisions, and he can give consent, and he's fully aware of what's happening, the only really thing that a hospital can do is encourage the patient to take the safer plan. And that kind of gets into a gray area, especially with a lot of healthcare professionals, since they know it's not really doing the right thing. But all factors considered, what do you think the hospital should do? So to conclude, inpatient facilities are faced with many ethical dilemmas, and they're very often overlooked, as these are only a couple of them. I had to filter through many different articles of so many different ethical dilemmas that are seen in inpatient facilities. Like, it's insane. So I personally think that these issues need a lot more attention from medical ethicists, and I think this topic could easily be a topic for further research. Again, I just scratched the surface. There's so much more that could be talked about. And then I have my references listed there in my PowerPoint. Thank you guys for watching.